Hi, and welcome to Ask the Chiropractor. I'm Dr. Corey B. Rodnick, and it's so great to be here on this beautiful, beautiful fall day. So today we have Dr. Toni Rodnick.
As always, it's an honor and a pleasure to be here to help educate the city of Midland.
And Dr. Tamara Rodnick, Slusher. Okay, hi there.
Hi.
Hi, from Clare, Michigan. And you're on your 9th anniversary.
Yes.
Of that clinic there, rocking and rolling and just serving the public and helping people and miracles. And
Absolutely.
the whole thing with chiropractic is a miracle. I was just, one of my really great friends just passed on. He had a weird disease, Huntington's disease, a neurological disease, pretty horrible. And he was also a chiropractor. I went to chiropractic school with him. Before that, I went to college with him. Before that, we went to high school together. Oh, and before that, we went to junior high. And he just had such a great life. It was amazing how everyone came up and they were talking about all the great things he did and how positive he was. Sounded like me a little bit. It was almost like going to my own funeral. And, you know, that he was such a servant and all the miracles that took place. And people got up and said, you know, all the different things he did as far as being a chiropractor. It was like enlightening for me, that knowing that I can get out of here with a smile on my face. It would be pretty awesome. But anyway, what a great life it is being a chiropractor. I know you guys know that, but, you know, and the public doesn't know it. But that's, you don't find too many very unhappy chiropractors. Most of them are pretty much like enthralled in what they do. And
Because we make such a difference in people's lives. We see miracles all the time. And whether the miracle is the disease being cured or just the patient's attitude becoming more positive.
Absolutely. You know, we have a patient who's autistic, and he came in for, they were doing a study on asthma study, and turned out that, like, it changed his whole life around. And, you know, he's been a patient even ever since that. That was like 15 years ago or something. And he went from a kid to a giant person. And anyway, it's just pretty neat that, you know, he comes in and Dr. Neal, who had an auto accident recently, so he's not on the show until the end today, but he saw him and he just gave him a big hug. He picked him up right off the ground and gave him a peck on the cheek. This guy was kind of funny. Anyway, but we're going to talk about whiplash today, and nerve distribution, and a whole bunch of chiropractic stuff. So how many out there in the public have ever had a car accident? How about in here? Oh, we're 3 out of 3. How about the camera people? Anyone ever have a car accident?
3 out of 3.
3 out of 3 in the cameras. How about in the back room, in the, what is that called? The sound room, or whatever it is. We're not going to, well, I bet we're 3 out of 3 in there too. So most people have car accidents, and especially living in Michigan. There's 60,000 deer accidents a year in Michigan. I'm not making this up. It's straight out of the, I got that out of the records for the state police.
Well, you could drive along the expressway and you can see there's deer laying all over the place, so there you go.
And
they
they're not,
had to get hit by something.
Yeah, they're not old age deer.
Yeah, exactly. So.
At least we clean up our deer usually.
Yeah.
You know, that's nice. I go through some states and they leave the deer laying around. We're in the top 3 states of deer accidents. And it's because we have a lot of deer. And yeah, and cause a lot of accidents. And then it's snowing, so that you'll get a whole bunch of car accidents with snowing. And it doesn't have to even be car accidents, even though we know there's 60,000 car accidents, 50,000 car accidents in the state of Michigan per
Those
year.
are reported.
With deer.
Those are just the reported ones.
Reported ones. The unreported ones, there's more there too. So.
Wow, right? So who knows what the real number is?
Absolutely.
But it's a very significant number. And what happens in a whiplash? And again, a whiplash could be falling down the stairs. Originally, it was when we didn't have headrests, that the head would go all the way in extension and all the way back. So originally, that's what they called whiplash. And then we got headrests. Almost every car, I think I think legally, I think they made, I don't know. I think they made it into like legally you have to have a headrest. But still smashing your car, your head back and forward, and it happens in a split second. Can anyone remember in a car accident their head moving forward or backwards? I know I don't.
A lot of times you ask them where their glasses ended up, and then you can see what their head must have gone through, too.
Absolutely.
And a lot of people have their head turned to the side a little bit too when they go through a whiplash injury.
That's where most accidents are, that little turned head with a 10-mile-an-hour accident.
You can also get whiplash like at a roller coaster. Those are zooming, and then they change directions. And
the ones that stops real fast, too. Oh, God. But it's funner. A lot more fun. Yeah, that's it. I remember when we were in line that one time at, I don't want to say what kind of, not giving out a name, but it said Point, something Point. Anyway, we were at there, and I was wearing a chiropractic T-shirt, and people found out I was a chiropractor, and there were lines of people getting adjusted. I'm just
I had that
checking
same
people.
incident
Oh,
happen, yeah.
so don't wear a chiropractic T-shirt if you want to be left alone. It's like,
Yeah.
oh my God.
Great place to open a chiropractic office outside an amusement park.
Oh, definitely, definitely, definitely. Unbelievable, I would think. There must be several outside that something Point. Anyway, so what happens in a whiplash? Let's take a gander at this puppy. What do you think of that? This is whiplash injuries of the head and neck. And then we have the degenerative chart back there and the nerve distribution chart to my left. When your head goes flying forward, what we don't realize is we're tearing all the muscles that come across here, the ligaments. You can see these ligaments. And there's ligaments that run on both sides of the little square boxes we call the body of the vertebra, and it tears that. And so here's a good picture here, too. There's a box. See the box? This is the spinous process. Those are those bumps you feel in your back. And these are the ligaments. And these ligaments tear when they go flying forward. And behind this, in this area, there's the anterior longitudinal ligament. And then, where's the picture here?
Right
There. Okay, that's the ligamentum nuchae tearing. And I was just electrocuted. And apparently, I had torn this, and it tightened up, and it squeezed these discs kind of burned up a little bit, and it shortened me about an inch. And when it's shortened, it's kind of like hitting a marshmallow, and it squishes out the fronts and the backs, and so it's squished out into the back on the one side. So those were bulging discs or ruptured discs, depending on which one you were looking at. And then on this side, these ligaments, ligamentum flava, it's not showing it, but it actually pushed into my spinal cord. Anyway, so on both sides, here's the cord. It actually, these ligaments pushed into my cord on both ends, and the bulging discs pushed in on the other end of it, so it was like strangulating my spinal cord. It took me about 3 years to get back to normal on that. I haven't got a new MRI, but the new X-rays, oh my God, they look so good.
You bring up an interesting point where you mentioned how you lost an inch of height because of what happened in that traumatic injury. I lost 2 inches from my car accident. So that is something that usually results, whenever you go through a whiplash injury or go through a compression that goes into the cervical region, that's what results is people lose height, which means that now, there's been damage done to those ligaments and you have to repair that area. And some people, when they finally come into a chiropractic office, have said they had their accident 10, 15, 20 years ago.
Yikes,
And they
right,
didn't even realize at the time what kind of damage it did to them. So,
Well, when the ligaments are torn, the bones can actually misalign, and then if the ligaments heal with the bones out of place, then you're losing the relationship of the bones, and the spaces where the nerves come out can be compromised too. A lot of times in a whiplash, you lose the cervical curve, so it becomes a straight curve or even a reversed curve, and that can affect the nerves that come out of the cervical area.
And where do those go to, one might ask?
A lot of times in whiplash, it's C5, C6 where it's affected most, and that goes to the hands, that goes down the shoulders to the hands. It goes to the heart and lungs.
So we see a lot of, like you said, somebody will come in 10 years after a car accident. They'll go, I don't know, my hand's getting numb. Or they're saying I have carpal tunnel. And then I lift up on their head with about a pound or two. I go, does your hand feel better? And they go, yeah. You're a miracle worker. I said, well, I'm not walking around with you all day like this. You know, I'm letting go. Ah, it hurts again. Okay, so that would tell me immediately that it's coming out of the neck. But the thing is, some people go in for carpal tunnel surgery, and it was, I think it was it Aetna or one of the companies in one of the states wanted to know how many people could be helped with cervical adjustments for carpal tunnel. And they said you can't have carpal tunnel surgery until you had so much chiropractic care already done. And turned out 80%.
Canceled the surgery?
80% did not need carpal tunnel surgery because of cervical spine things. So again, from whiplashes.
Well, the nerves that eventually go through the carpal tunnel that affects the thumb and first two fingers and part of the other one, before they get to the hand, they have to pass through the wrist, the elbow, the shoulder, and the neck. So you can have it affected, any of those areas can affect the same nerves.
Tell us about the crush, the double crush, the triple crush.
So that, as you said, there's crush, the double crush. Double crush means that the nerve is affected in two areas, like the neck and the wrist. So it's not just additive, it's multiplicative. It's a lot worse if it happens in more than one area.
You know, a lot of times in a whiplash injury, I notice these the scapulas, those shoulder blades, span out. And so the person will be complaining, oh, my shoulder. So they can also have a whiplash in the neck going into the shoulder, but they can also have their shoulder misaligned. And that scapula kind of flared out. And now they're riding and nothing's protected back there, and they have all these different pains going on. And a lot of times I will adjust that and correct that. Also, if there's some tears in there in the shoulders, they can heal when they're separated, but when you put it and line it back up, inside the body will start healing that. Also know that these discs can be damaged and they can also correct themselves as well, just like most every part of your body. You can take an arm, bust it in half, and if you leave it there, obviously that's bad, it'll grow like that. But if you line it back up, it'll heal. And usually for a broken arm, it's only 4 to 6 weeks and the body heals that thing. So it's pretty dang amazing. Muscles heal in 2 weeks. Tendons are about 4 to 6 weeks. And ligaments take longer. Maybe like years instead of months, but it takes a while. So you can see here the head's going forward. It's tearing all of this. It's affecting all these nerves. Then it bends way back. This is the same view here with the muscles attached to it. So you can see all these different muscles, and these muscles tear. They can actually tear.
And the ligaments up
And it
front
only
are tearing
takes
too.
seconds for it to happen too.
Split second.
Yeah, that's the other important.
It's so fast. I remember once I hit the front windshield and the back windshield in a car accident. And the only reason I didn't go through the front windshield was, you know that bar that holds the actual glass on? I hit that bar with my shoulder and I broke my collarbone. And that was a little painful, but I got over it. But anyway,
You can also have a whiplash to the side as well. I wanted to clarify that just because that was what my car accident was. My
That's
head
way
went
worse. Yeah.
sideways through the
Sideways is
window.
definitely worse.
And came back. Yeah, and you know, there's a lot of things to be said about, oh, well, you'll have headaches the rest of your life. You're never going to be able to have full motion with your neck. The one thing I can
hate
contribute
when they
to
say
is,
that.
well, you know, that night after I was released from the hospital, I went to a chiropractor right away, and just from doing the different therapies and from getting the adjustments and doing the proper exercises at home, you know, in less than 6 months, I had the curve back in my neck. So, and it was back to a normal curve. I was completely a reverse curve. And, you know, I've been under chiropractic care for a long time.
Yeah.
So, yeah, so I knew, get this taken care of right away. So you think of people that have been through things like this, or have been in different jobs where things like this have happened to them, and they haven't done anything, and now it's years later, and these are the things that result for them.
You know, there's a chart behind you, the 5 segments of a cervical spine degeneration. And to the left corner, that is a normal looking spine.
With a curve, you can see there's like a curve. You can see it more in the diagram there.
And then you see the next one, it shows a reverse curve there. And what I'm pointing out is, see, it says, that's a spine, but I want you to see the 6 months to a year and a half. So you were corrected in 6 months, could be about a year and a half. That's just for a regular whiplash with no degeneration, no nothing. Then the next one shows more degeneration, and that's a year and a half to 2.5 years.
When he says degeneration, the disc space, you can't see the discs in an x-ray, but you can see the space. The disc space is actually decreasing. And then the body, when there's areas of stress, we put different material to it. So there's a little bit of spurs or a little bit of osteophytes growing on the front of the discs, the bones where the discs are affected.
And that's if you just leave it for a certain amount of time. It's just degenerating at about 4 to 6 times the normal rate. So in 10 years, you end up with you could have a 40-year-old neck, further, 40 years old, 60 years old. So if you're 20 when you have the accident, and you had 60 years in 10, so you have a 70, you have a 80-year-old neck in 10 years. Like if you look at my neck after I got barbecued, I looked like I was about 90 to 98 years old, about, something around that age, like just a little under 100, close to a 100-year-old neck. And it happened like just so quick. In 3 months that happened to me. Yep. I did a lot of guys, we go out and we say, I'm okay. I'm okay. Yeah, right. So, I thought I was okay.
You thought you were okay that day, but, a few days later it started.
Well, yeah, I noticed things like, I couldn't put a sock on. I couldn't raise
things
my arms
that you would
up.
normally be able to do, yeah.
And my arm was stuck like this. I couldn't straighten my elbow. That should have been a sign. I don't know. Took me 4 days to notice the exit wound on my foot. So, yeah, because we were fire walking and all that.
Right, we
I
did the
must have
fire
burned
walk.
myself
So,
with the fire walk.
absolutely.
No, there's a hole in my leg. I'm like, okay. It's pretty funny. Tony goes, that's not from a fire walk. That's where you got electrocuted. I go, oh, God. So anyway, 3 months later, I took a picture, which I should have. That was silly. But, I was driving myself thinking, don't be a wimp, don't be a wimp. I worked harder. I got there, I was seeing more people. And that was like really not a good move on my part. So, but I got better. Each x-ray showed it getting better and improving. It's like unbelievable, the stages of this thing. And I regenerated. It looked like, about 40 years of degeneration. It's gone, and the discs look fat and fluffy again.
But because you waited so long, you still have a lot of work. The curve in your neck still needs more improvement.
Well, that didn't help. But I'm just saying, I grew the discs back, though.
Which is amazing.
So people say, those discs don't ever grow back. Baloney. I've seen it in my patients. You've all seen it in your patients. And I see it in me.
I've seen it in myself as well, yeah.
Yeah,
Lost that height to the disc and then have gotten some of that back.
How much did you get back?
50%.
50%, okay.
Yeah, so I lost a little over 2 inches, and I've gotten back a little over an inch. So, yeah.
Very good. I think I got my inch back. I think I'm really right there. I'm right there. I fluffed my discs. Anyway, but surgically, medically, surgically, it looked like definitely fused that neck. I went from fuse that neck, what are you going to do? This is dangerous, to, hey, I don't think falling off motorcycles is good at this point, which I did this last year, but anyway, shouldn't fall off the motorcycle. But, I like to do fun stuff a lot, so I'm always like injuring myself over and over again. And
but you get checked right away afterwards, then
I do.
the residual is a lot less. Exactly.
Yes. But I was getting adjusted right after that too. Remember, after I got electrocuted, I got chiropractic care right away. But then I needed to do everything though, from nutrition, physical therapy. I got checked by every doc, acupuncture. I changed my whole diet around, the exercises. Oh my God, I just did everything. Ooh. The 5 stages of health? And I started sleeping more. I even pulled that one out of a hat. I used to never sleep right, and here I was constantly sleeping right. So here it is. So people get in car accidents and they don't even realize this happened. They go, oh, my neck's sore. And then guess what happens? The muscle heals, pain goes away a lot of times, and then they don't do anything about it. In the meantime, they should have got checked.
Well, the misconception is they go to the hospital and they get checked, or they go somewhere, and if there's not, a fracture, or they're not looking at the soft tissue. What they're looking at is hard tissue. So they're looking at if the bone wasn't fractured or if nothing else was fractured in that area, then you're fine. And that's the misconception. You're fine. So people go home and think they just have to wait it out. And this is what results.
Correct. Like even my son Neil, he's got 2 ruptured discs in his neck. It looks like, or herniated, or what do you want to call it?
Protruding is what they'll say, yes.
I think it's
had
a
the same thing.
broad-based disc herniation you think he's got. Anyway, that actually pushes into the cord, so you got to be careful and things like that. But we're going to get better. It's going to take time, but it's nothing quick. But just leaving it alone, it doesn't really get better. Your pain might go away, but the actual joint keeps getting worse and worse and worse.
Well, discs, they don't have any circulation and nutrition after a certain age. The way they get the nutrition is through motion. And then if your bones are misaligned and you don't have the same range of motion, you're not getting the nutrients into the disc. You're not getting the same proprioceptive signals to your brain, so your brain doesn't know what's happening with your neck either. So it's like a one thing leads to another, and it just keeps spiraling out of control.
Let's kind of look at this spine for a minute. And so, normally when you bend, you see how these open up, these move, and then when you come backwards, they come back together, and like the normal curve, is similar to this is actually a straight curve, but I'm just saying you see that flaring, and what happens in a whiplash, these bones get stuck, and so when it bends, these don't move. They get stuck like that, and the only thing you're moving then is from up top, and so by not moving, like you said, you're not getting circulation in there. So by not having the circulation there, it keeps degenerating faster and faster. And this kind of shows it a little bit. So here's the neck, is what they ended up with after the whiplash. But you see how this part's a little straight? And here when he bends, these guys here aren't moving, these lower cervicals. They're not moving at all. And they're like stuck in that position. And so what happens is by leaving it alone and not getting that to move, month by month it gets worse and worse and worse. And you may feel it right away. You might feel it several years down the road. I had an accident one time, and I remember I just had a little piece of skin, just a little teeny, like nothing. And I just pulled it off, and that was it. I went like that, and I was gone. 16 days later, I end up in the clinic, and I'm on fire between my shoulders, totally on fire. And I said, what's going on? And they said, well, they went and got some x-rays, and they checked me out, and they said, so when was your car accident? And I said, I wasn't in a car accident. And they laughed and said, no, when were you in a car accident? Let's ask it that way. And I said, well, 16 days ago I was in an accident. And they said, that's what happened. So sometimes you don't feel it right away. Sometimes you do feel it right away.
Well, sometimes this is so severe for people that the neck becomes primary for them, that when it starts to get better, other symptoms surface that have been underlying symptoms from that same accident. So it's not always that right away in the first 48 hours, so you're going to get every symptom that you're going to get from a car accident.
This was somebody making a left turn over 8 lanes. They were in the right lane and just drove straight into my car, hits my little Omni car. I go flying in the air, through a bunch of flagpoles in the air, and then I landed. Okay. So I get out and I go, oh, there's a little scrape. I was wearing shorts. and I go, oh, I'm okay. And I went like that. And that was the end of it. 2 weeks later, that's when you experienced the pain. Oh, my God. It was like I couldn't relate the car accident to this burn. I thought someone dropped an ashtray in my back or something. It felt like a burning. And, boy, it took me about 6 months easy to get back from that. 6 months, a little longer than that, but boy. Well, they told me it would have been a lot longer to do the work that needed to be done if I had even waited 2 more days
to go in and be checked out and evaluated after the car accident by a chiropractor. So,
Wow.
can you imagine? It would have been another 6 months to a year's worth of work on top of what I already did just to get that curve back.
So let's talk about cervical symptoms. What symptoms do you get when you have a whiplash? What kind of symptoms can you get?
You can get headaches.
There's
That's
a biggie.
pretty, yeah, that's a pretty
biggie.
severe one. I had never had headaches before I had that car accident.
Oh,
Ever.
really?
Never had a headache, and then had that car accident and got to experience what a real headache is like, and said, never want that again.
And now you can feel for
Yeah.
your patients.
Yeah,
You know,
absolutely.
that's the
Yeah.
good news on that one for all the people out there.
Yeah.
Because until you really have one, it's hard to relate to them. They're like whining about their stupid little headache. But once you've had one, you go, good God, man, that's awful. You know?
Yeah, it's worse.
And all the different types of headaches. What other kind of symptoms?
Also from the neck, there's a lot of sympathetic nerves. That's the sympathetic nervous system is the fight or flight, and so there's like a chain of ganglion, cervical sympathetic chain on the side of the neck, and when those are affected, you could have increased anxiety, stress. You just don't know what's wrong, but something's wrong. You're just so tense and uptight.
Yeah, absolutely. Well, we already talked about going into the shoulder pain, and it could have elbow pain, and you can have. How about energy-wise?
Oh, you're so fatigued.
Oh,
Whenever you're in pain, your body fatigues out very fast.
and just
Very
here, your pinch
fast.
of nerves, you lose 60% function or so.
Yeah.
So you're running at like a 65% loss of energy. So that means to do an hour's worth of work, you got to do, it feels like 3 hours of work. So to do 8 hours of work, you're done. You're cooked. So it's like you lose a lot of time and energy out of your life from a whiplash. Could this be done from a football injury?
Sure.
Could this be done, again, slipping on the ice is another one. Whiplash injury. Falling down the stairs.
And you don't even have to fall when you slip on the ice. A lot of times people try to catch themselves and they
Which
catch
ends up
themselves
worse
and then they
even.
get the whiplash.
Yeah.
They didn't break the bones when they landed on the ground, but they ended up with a whiplash.
What else can you get from that? How about ear problems?
I was going to say, I had a constant ringing in the ear until Atlas would stay in place the way it needed to. That was awful.
So ringing in the ears,
oh,
ear
just
problems.
this buzzing just on the one side.
How about
yeah.
dizziness?
Yeah, dizziness, lightheadedness, those kind of things. Yeah.
Foggy feeling? Those are all go along with the cervical whiplash. I haven't even got into other whiplash. You get a lumbar whiplash too. But I'm just saying.
It also can affect your eyes. My eyes seem to be blurry on one side for quite a while too. So that's another thing they said that
Blurred vision.
you know, because you're getting that your brain is just being smashed to one side of the skull. So, you know, yeah, of course that's going to affect you.
Ear ringing, and I'm just reviewing. How about jaw? Jaw pains
TMJ.
and TMJ problems.
Yep.
What other kind of things are there? You know, whiplash injury. I got the numb fingers, the wrist can be sore. And guess what? One day you go, oh, my wrist is killing me. The next day you go, well, it's gone, but now my elbow hurts. You know, or a week
Yeah.
later, I go, man, it's in my shoulder and my wrist, but my elbow was hurting earlier. It's like really weird. It
travels.
moves
It-
around,
yeah, it moves
and
around.
oh man.
And the nerves from C3, 4, and 5 go to the diaphragm,
So
it
hard
can
to
affect your
breathe.
breathing. Yeah.
Could affect the breathing. Hard to take a deep breath.
Sinuses are another one too.
Definitely.
People that haven't had sinus trouble before will start complaining about constant draining because the sinuses just won't stop draining all the time.
I
So-
almost don't want to say this, but I'm gonna. I never say this. Probably somewhere between 80 and 90% of all my whiplash injury people within 2 weeks are sick with a cold. I mean, a really high percentage.
So your resistance is affected
because your
too.
resistance is
About
affected.
5 days later after the accident, I got severely sick.
You know, I don't want to say that to a person.
And then it
you
gets
know, because I don't
misdiagnosed
want
as
them to think I have to get
sinusitis.
it.
You know, and those kind of things. And really, you get adjusted, and all of a sudden, now things are starting to fall in place. The bones are doing what they're supposed to do, you know.
And then they get
Makes
sick, and
sense.
if they take an antibiotic or something, then the resistance goes even further down.
Now you've really
It's
lowered
like,
the resistance.
it just
yeah.
keeps going. It's like a spiral. Oh, but I don't want to say anything, other than I say, you know, I want you to start taking some vitamins. You know, I want you to sleep more. You know, maybe take a week off of work here and rest. you know, and then we start them on some rehab.
But
you know,
if you don't
exercises.
say anything, that can also bite you too, because then somebody gets sick and then they cancel their appointments because they don't feel well, and they think it's not helping them. So, you know,
Yeah.
you have to
Well, I don't want to
inform
give
them.
them a thing saying, you know, most people have
Yeah.
a cold after this, so take care of yourself. I just try to, I'm like, it's just a fact, the way it is. It's just a number. You know, after a whiplash, you're going to...
It was actually the ER doctor who told me, you're going to get sick from this accident.
That's what he said.
Yeah.
You're going to get sick from this accident.
He said you can go to urgent care and you can go see somebody there, or, you know, he knew that I was already getting adjusted. I was a chiropractic student at the time of the accident, you know, and said you're going to need to take care of yourself. So, yeah.
You know, which tells us, you know, they should do more research on this. To me, it's like ridiculous. I know that was between, what was it, like 50, in the last like 10 years, we had like between 51 and 60,000 motor vehicle accidents in Michigan alone. So
Just deer car
that's
accidents.
just deer
Reported.
ones. Those are just reported deer accidents. I'm not talking about all the other accidents, all the cars hitting cars and all the other stuff. It's like, wow, I can't imagine what that number, it's got to be ferocious. Just unbelievable. Such a high number. And to me, that's just a ridiculous number. So I actually went to the center and said, why don't we build giant fences across the expressways to stop the deer from going into the road? Because, I mean, your worst accidents are obviously going to be going 70 miles an hour and hitting one of these suckers. You know, you're hitting a 200-pound, 150-pound animal. I mean, there's trucks, they don't even notice it, I don't think, some of them. They'll hit a deer, scramble them, turn them into hamburger meat, and it's just, you go, oh, look, hamburger meat. So I don't even think they flinch that much. Because I remember I was driving a truck and we hit a bull head, just the head. I don't know about the rest of the bull, but it was you know, one of these rainy, snowy kind of, it was on and off and dark, and I guess this bull was out in the street and sticking its head out, and I, you know, went kink. I heard a little noise on the fender.
And that was it?
Yeah.
But with cars, it can really affect the
Just
car
trash
and the
'em.
people inside the car.
Yeah, just trash
The
'em.
whiplash and
Yeah, and definitely. Now, there was a train wreck in Europe. It was a 5-mile-an-hour train wreck, and it was like 40% of the people, something like that, either broke a nose or broke an arm from that accident. You know,
At
just
5 miles an hour.
It was only 5 miles an hour.
So think about the average car and the speeds that people are going when an accident happens.
And I hear people say, "Oh, it was only 10 miles an hour. I couldn't have got that hurt." It kills some people.
Yeah.
If you're all screwed up to begin with, especially, that's enough to finish you off. It's enough to like.
And that's why you should always wear your seatbelts.
Definitely.
I always talk to patients and ask them, you know, when they first start up under care and say, how many of you have been into a car accident? And there's a bunch of people that raise their hand. They say, but it was just a small rear end. I think it was only 5 miles, 10 miles an hour. And I said, okay, well, we'll look at your x-ray and we'll show you, you know, what kind of damage has been done. And we can pinpoint it was 20, 30 years ago.
Right.
And they see the damage and they're just astounded. They're just astounded on, you know, how much damage has set in because they didn't do anything for it because they thought their neck was just a little stiff. They just strained their neck and, you know, they might have wore a whiplash collar for a day or two and then they were good to go.
And the pain went away
You
and
know?
they thought they were
right.
fine.
And there was no headaches, the pain's gone, so they thought they were fine. And now they come in 30 years later and she can't feel 4 of her fingers. You know, those kind of things. So there you go.
One of my favorite questions is to ask them, so how do you back your car up? Do you turn around and look? And they look through the mirror because they can't turn their head anymore.
Right,
It only
because
goes
the
this
motion
far.
is not there.
Yeah, it's only this far. I go, how do you back your car up? They go, I look through the mirror.
Yeah.
Because they come back and they're backed into something, you know? And I'm like, that should have been a clue.
That's how I know when my
And they
neck
go-
is locked if I can't see behind me because I'm so used to being able to. So, you know, I tell people to judge it and be able to measure it. How far can you turn your head? Okay, can you go further, you know?
Yeah, you said you ask a question, how many people have been in an accident in your health talk? Well, I go further with, I go, how many were in 2 accidents? I go, how many were in 3 and above?
Yeah.
And when they say 3 and above, I go, make sure I leave before you guys.
Nice.
But,
Yeah.
although I'm one of them. But anyway.
Yeah, I've been in 3 or 4 of them myself, so yeah.
Oh, man. Wiping out on bicycles. And just all the little, how about the tricycle? Going down the steps. Did anyone ever drive a tricycle going down the steps with these little walker things? Yeah, and you don't think nothing of it, but oh my God. How about my first children's whiplashes that I can definitely say it happened? How's this? They're sitting on the couch in the little toddler thing I have, a little baby carriage thing. What do you call that?
Swing?
A swing.
Or the carrier?
The swing, the carrier. They're in there. And then I go, the phone rings, I go to reach her, and I look down, I go, there's a kid down there. I look at the couch, I look at okay, this one's walking, this one's crawling now. Each one of them. I did that to like every one of them. I don't know how I still missed it on every one of them.
That's why we ask all the parents, that have the young children, how many accidents, how many falls has your child been involved in the first 6 months of life?
Wow.
Number would astound you there too.
Wow.
And then once they start
Roll off
walking,
the
when they're
bed.
not steady on their feet, they just keep falling on their.
Sure.
Good thing the diapers are there to pad them a little.
It does help. It does help. And if you got carpet,
Yeah.
that helps with a pad.
Yeah.
Yeah. If you're on the hard floors, boy, that's tough. Anyway, yeah.
I would say my first whiplash injury was at City Forest on the sledding hill. The kids don't look out, and you're going down that hill, and you're going down that hill really, really fast. And this is a really tall hill over there, and we would go sledding any day it was snowing. We would go over there and go sledding, and you knock kids out as you're coming down that hill. So, yeah, you go through some whiplash that way. So
Skiing accidents.
And you don't even think about that. You go home and you think, oh, yeah, I sledded all day. That's why I'm sore. Well, there was more to it than that, so. Yeah.
Yeah, the snow sledding
Tobogganing,
and water
yeah.
sledding and tobogganing. And
Yeah.
I was just thinking all the times I wiped out snow skiing. I went off a cliff once. But I landed on this really nice lady. so she kind of
Yeah.
broke my fall pretty
Yeah.
good.
She probably got some whiplash herself.
I don't think she skied much after that. But yeah. Oh, man. That was probably 20 feet drop. And I just ducked her. And then we rolled together in a nice bundle.
I see a lot of people in January for snow tubing.
Yeah, you have a snow place right by you.
Yeah, we do.
And
So,
yeah.
we see quite a few from skiing and snow tubing and all those kind of things.
How
yeah.
fun. And we used to build a little snow ledge. So as you're going down, we'd hit that snow ledge, go
Yeah.
flying in the air, boom,
Fly and then go down,
flying.
yeah.
I mean, that was the best,
Yeah.
right? We put a lot of time and energy. And then you actually have to hit it with this primitive steering technique, like, put your hand down,
Yeah.
drag on the left, and boom. Oh, and
Yeah.
every time you land on that thing, Whiplash City. Oh, God. I'm now remembering other things. Going down the cliffs, there was like a cliff thing. Very steep, and there were rocks and boulders, and we'd hit that, go flying in the air, landing at. As a kid, I was about 12, 13 then. Oh my God, my poor friend, he really hurt his disc from that, and that was a tough one. Man, oh man. How about grip tests? I know I use that in the office quite a bit, especially
Yeah,
on all my
absolutely.
whiplash people. We compare one side to the other, and if there's let's say you're right-handed, it should be maybe equal or 10 pounds more. But let's say it's 20 pounds less squeeze on your dominant hand.
side, yeah.
I mean, that gives me a way of judging that you are mucho screwed up. And just gives you an idea if you're getting improvement or not. We could check it again later. And yes, indeed. So on falls, so it's getting nasty out. You'll notice I wore my good shoes today. I'm wearing my special tennies because I didn't want to slip. But anyway, I could have changed when I got here, though. So no excuses. No excuses. But the proper shoes for the type of environment that you're in. So if you're going to be on your feet all day, you want a lot of support, maybe foot levelers or some kind of orthotic in your shoe, things like that. But it's getting slippery and nasty out, so slipping and falling is just critical. Like right now, I can't afford to fall after just having massive degeneration, whiplash, or whatever you want to call it in my neck, or electrocuted neck, however you want to call it. So I got to be very careful. I've been like protecting myself. And people need to do that anyway.
I have a lot of the elderly people that will wear the tracks that go over the shoes now too, to protect themselves so that they don't have to be looking down at their feet all the time and worrying about if they're on the ice or not too. So
You know, we were using a special ice feet out on the, where were we? Traverse City. We were in the, we were out in the, what is that, Lake
Snow
Michigan?
caves, yeah.
Went to the snow cave. So we put little slippers on that had metal spikes that you get for snow. And they had different sizes and different things like that. So if you're going to be walking in the snow quite a bit, that was very great. I mean, that was terrific.
they have them for running that I can wear on the bottom of my shoe. To
Oh,
run
really?
In.
Okay.
Yep.
I mean, I wouldn't want to use it on a wood floor. Yeah?
You made a
Well-
point that because of your injury, you can't afford to injure yourself again. A lot of people, as we age, we don't heal as quickly as we used to. So you don't want to injure yourself. You want to prevent injury so that you don't have to struggle with healing, or like diabetics heal slower. So a lot of people, they should be protecting themselves and making sure that they don't injure themselves.
Yeah.
Yep.
I had one of my patients, and she went like this, like this, like this, and it got to the point where she was like really like bent forward. So I
Yep.
told her, you got to start getting your ears back. And it was because in the nursing home, they're telling her to watch your feet.
Watch your feet when she was walking.
So
Yep.
to watch your feet, she's got to like go like this.
Yep.
So she's looking down the whole time. So I said, well, maybe get a cane. Gives you a third one, and then you can just look down, you know, a little instead of like that. So it was bad posturing. So I don't know what to do.
Well, when we're walking and when we're maneuvering, our body knows, we have a sense of proprioception, our position in time and space. And a lot of conditions, you might lose your sense of proprioception, so that you need to use your eyes too. So you got to look down and see your feet so you know where you're at. A lot of conditions, you might close your eyes, and because now you don't have the eyes to, you like lose your balance and you start falling and stuff. So it's a real thing. They don't know where their feet are. So that, like you said, you got to find other ways of doing it besides just bending over and slowly.
Yeah, because there you're
destroying your
extending your
neck
neck
and spine,
forward
yeah.
and then looking down. And it's like, you know, if you do that for a long period of time, unless after you're done, you know, you do 20, 30 of these, you're fine. You know, you got to put it back. You can't just keep doing it day by day and little by little destroying yourself.
Those
So-
who get their neck adjusted too for C1 for balance issues find some kind of relief from it. I mean, there are definitely less residual problems, and they notice
Correct.
that they are walking better and that their proprioception is a little bit more on cue, so on point. So
Definitely.
it helps.
I know it messed mine up.
Yep.
Boy, I would bend over and bend down. I would get dizzy. The world would start spinning, and oh my goodness. And not so much anymore, maybe on a special occasion if I do something weird. But other than that, but boy, that's debilitating. I remember, I don't know if you remember when I was adjusting that little Bengal tiger, and it got out in the news, and I had like, you know, 7 people in the waiting room the next morning, all with the
with the
same, with the
torticollis.
torticollis. Well, several of those torticollis patients had that, you know, hang on to the wall dizziness thing too. So it's probably about 20% of those people, you know, well, 2 out of the 7. So what is that? But anyway, so quite a bit of that though. I thought that was significant, and again, adjusting it helps that immensely, like get rid of that dizziness. And yeah, a lot of people don't know that chiropractic started with a deaf guy. You know, that's the first patient was deaf. He wasn't for neck pain, but and that's huge. So, what else? Let's look at the nerve distributions on this, huh? So we're going to look at the neck here, and you can see this is a. Can you close in on this here? So this is the side view of a cervical spine with the skull. And you see, like when she says headaches, frontal headaches comes from the top bone. C2 usually is these back ones here. And I mean, you can just see how they go. They come up the way they are distributed. And then going into the middle ones, they come down the arms, they can hit the shoulder, they can come down and hit the elbow, they can come down and hit the wrist. Not that your wrist can't be misaligned because you're holding a steering wheel.
You grip it harder too if you know
grip it
you're about to
harder.
be in an accident.
Especially when you see your fingerprints inside the steering wheel, you know that was not done normally. And so you have this distribution also. So you get the idea. Like some people have pain like right here. You know, they might say, oh, they have tennis elbow. And so it gets an idea that, you know, it can hit the shoulder. It can hit all of these at the same time, or get a shoulder here and an elbow there. It depends which part. It's an electrical system, so which connection you have going on at the time. And it does move, because as your spine moves, the symptoms change. So pretty normal on that. You know, and again, sometimes you don't feel any symptoms, you have a whiplash. And just the degeneration is pretty devastating, really. And you can see how it can affect the brain, it can affect all kinds of things. And a lot of the nerves going in and out, and the communications to the brain can get affected as well. When these top two bones misalign, you know, then it puts pressure on the spinal cord, because the cerebral spinal fluid that's made up right here in the brain flows down the cord, comes all the way down, and then you have a pumping action down here in the sacrum, which pumps it back and forth, so it keeps this thing circulating. But if this gets misaligned, or this pinches it off, so you'll end up getting like the headache and the sinuses and they call it upper body congestion,
like congestion or fog,
and lower body starvation. So you're really tired, and the rest of your body, like you were referring to that earlier, and this is why that happens. So the top part gets all congested, so you'll end up with your headaches, dizziness, eye problems, ear problems, sinuses, and going down here, you're not getting the nutrition that it normally would get. It's bathed with nutrients, and it doesn't work anymore. And so it stops until you get that thing so it starts pumping again. You'll be exhausted from here down, well, it's actually higher, from here down. And that's not including the spinal nerves going into the shoulder, arms, and fingers. I'm just talking about the cord there for the moment. So that's kind of how it goes. You can also have a whiplash in the lumbar area. That's where, see, this area is thicker, the nervous system, the spinal cord, is thicker here because you have legs. And it's thicker here in the middle of the neck because you have arms. So these nerves from the arms come out of this arena here. So this is a little thicker when you look at the cord. The whole cord area is thicker. And so when you have an injury, it's going to feel worse there because there's not as much room in there. So you're going to pinch it more there. And that's why those two areas are more. So this is basically everything you ever wanted to know about a whiplash injury, but we're afraid to ask. So any comments you would like to give on that? On the distributions or anything?
Well, the biggest thing is to be careful with, you can also do it from using equipment the wrong way too. I had a gentleman who just came into the office that just started up last week that his chainsaw got in a rut while he was cutting and splitting wood, and he went through a whiplash injury, and it went to the lower region for him. And you know, the symptoms didn't result the first day, the second day, or the third day. It was the fourth day when he woke up and said he felt like he had been run over by a truck and couldn't move and couldn't do anything, and he couldn't contribute to what he had done. So I asked him, what did you do a week ago? What did you do 2 weeks ago? And that's when he started telling me he's been splitting wood and getting ready for the winter and stuff like that. So people need to be careful with basic activities that they do too, where you can jar your spine and go through a whiplash injury as well.
And once you've had a whiplash injury, pain is only one of the symptoms. And even if the pain goes away, you should be checked by a chiropractor and make sure that the bones are aligned and so that the nerves can function at an optimal.
Yeah, absolutely. Any whiplash injury, just go get checked back at your local chiropractor. Very simple, very safe. We're the most safe and effective in that arena of all the things that are out there. Yay! Yay for us. And we could do probably the most good. Now, sometimes, you know, there's times when we send them to medical doctors, and there's times that, you know, they need surgery, and there's times, but that's no problem. You know, I work with a lot of these guys, and it's No problem
When we
at all.
know to refer out, we refer out.
And usually if we do refer out, you really should go, because it's
Yeah.
probably a good reason for it.
Absolutely.
Because if we didn't have to refer out, we wouldn't. And anyway, I think that's pretty much it. Every now and then I'll see like a fracture here. The fractures in the spinous process, or in these side ones, like these transverse processes, not a big deal compared to a fracture in the back of the box here, this little square that shows up. Those are much more critical. So fractured spines, most of the fractures are no big deal. Some of the fractures are a big deal, and then you need to know that. And we have braces and different things you can use for
And they
that.
can still function after. I have a patient who just started up a month ago. She had a car accident 40 years ago and fractured C1 and C2.
So I understand you have some nice exercises that would help people who have whiplash injuries, and posture exercises as well. And we're going to go and go to that now. Thank you so much, and you guys, I so appreciate you guys. Thank you.
Thank you.
All right.
All right, welcome back to Ask the Chiropractor. So we're going to go ahead and get into our spinal hygiene exercises. These are exercises to help your spine. It keeps things, it's kind of like brushing your teeth, only for your spine. It just keeps things moving. Good motion is working. So we're going to go ahead and start with our the spinal hygiene Straighten Up America exercises. We're going to start out getting into a posture perfect position. We're going to go shoulder width apart on our feet, shoulders back, heads back, and then we're going to get our first exercise is called the eagle. So we're going to start out with our hands here. We're going to go out to the sides, over our head, and we're going to just kind of stretch up with it and go back down.
As you're going up, you're going to take a deep breath in and bring it up and hold it and stretch. As you go up, you tip your head back, and as you go down, you tip your head back to the neutral.
And our next exercise we're going to do is called the hummingbird. So we're going to bring our arms up like this, and we're just going to do some small circles to start out with.
These are backward circles with your shoulders, and as you do it, you're going to focus on the space between your shoulder blades. You're going to be tightening those muscles. A lot of times in our society, we're always hunched over the computer, and we're doing things like this. So here, we're strengthening the back muscles.
So a couple variations too with this. We can do some larger circles with our arms, smaller circles, and then this one's called the happy hummingbird. We're going to just kind of tilt back and forth to the sides. That works the mid back a little more, just getting that extra motion in it. All right. And our next one we're going to do is called the butterfly. We're going to just take our hands, link your fingers together. We're going to go back behind our heads, and we're going to just kind of push our head back through our fingers. You don't want to be pulling your head forward with your hands. You want to be pushing your head back through the fingers.
Again, as you do the exercise, take a deep breath in, push back, hold it, and then let it out as you relax. Breathe in, pushing back with your head. This is the one that'll help offset those whiplash injuries because it'll start getting curve in your neck. You're strengthening the muscles in the back of your neck. Another way of doing this, you can, when you're in the car, every time you stop at a red light, push your head into the headrest. You're working against the headrest. You get some tension, some tension there, and you're just kind of bringing your neck back, strengthening the back muscles.
Right. So our next exercise, one of my favorites, we're just going to do something called the trap opener. You can kind of do this one hand at a time, both hands, but you're just going to grab this muscle here right above your shoulders going into your neck, and you're just going to kind of loosen it up a little bit. Yeah, let's go ahead and do the two-handed one a little bit too. And next we're going to get into some of the star exercises. These ones are more for lower things as well as just getting more motion in things. We're going to start with, so go ahead and spread your feet a little bit more apart and put your arms straight out to the sides. And we're just going to kind of go off to each side. This is called the tilting star. And our next one is going to be similar to that last one. We're going to bring our arms up like this. And this one is called the twisting star. And we're going to just bring our elbow toward our opposite knee. And this one actually works some of the brain things too, because you're doing a cross integration between the two sides. All right. And did you want to do any more?
No, that's about it.
All right.
We've been having a pleasure with you today. Do remember to take care of your spine. These are spinal hygiene, so you want to do it at least as often as you do dental hygiene.
Something we recommend, something you can do kind of like brushing your teeth, so morning, right before bed, those kind of times.
Right. It just takes 2-3 minutes every time you do it. Do it a couple times a day. I'll end the way Dr. Rodnick usually ends. God's gift to you is life, and what you do with your life is your gift back to God. Thank you. Have a wonderful day.